Welcome. Welcome to today's Ethnic Media Services Zoom News Conference. I'm Sandy Close, Director of EMS. With record-breaking rates of drug-related overdose fatalities, including from fentanyl, in California last year, the opioid epidemic ranks among California's most challenging issues. Our speakers today highlight the work of 3 nonprofit organizations developing innovative ways to prevent and recover from substance abuse and advance health equity across the state. From remote rural areas of Inyo County to the unincorporated cities and towns of the Central Valley, to Oakland and its surrounding suburbs in Alameda County. All 3 organizations are grantees of the Center at Sierra Health Foundation, which is celebrating its 10th anniversary this month. There's no better way to honor the center's impact than to spotlight the work of its grantees, as we have the honor of doing today. Our speakers include Kei-Ying Hang, President of the Center at Sierra Health Foundation, Marie Perez-Ruiz, Executive Director at the Central Valley Empowerment Alliance, Arlene Brown, CEO of Crossroads Recovery Center and Skoden Native Harm Reduction Services, and Braunz Courtney, Executive Director of the HIV Education Prevention Project of Alameda County. Don't worry if you didn't catch all that. We will be sending you names with expanded bios for each of our speakers, plus contact information, because these guys are just terrific sources for follow-up interviews. We ask speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean. And we ask reporters to enter questions, as always, in the chat. Our speakers are encouraged to monitor the chat and answer questions that they feel particularly relevant to their work. We will send a video of today's briefing with those expanded bios and contact information this afternoon, as soon as our recording devices allow us to do that. So we begin today with Kei-Ying Hang, who will provide an overview of the Center at Sierra Health Foundation and its work in the field of substance abuse. Thank you so much, Kei-Ying, for introducing Ethnic Media Services to these remarkable organizations and their directors, and for giving us this opportunity. Kei-Ying, the floor is yours. And you're on mute, so just...
There we go. Can you hear me?
Absolutely.
Great. Well, thank you so much, Sandy. We are so privileged at the Center at Sierra Health Foundation to be doing this work with you and all of your partners at Ethnic Media Services. So thank you so much for presenting us with this opportunity. And I want to say thank you to all of our media partners who are joining us today. At the Center at Sierra Health Foundation, and we are a statewide nonprofit organization, we truly believe that every person deserves an opportunity to live a healthy life of their own design. And we're achieving this vision by focusing on access to care, quality of treatment, and youth prevention in our portfolio of substance use programs. We manage a number of portfolio, but for today, the focus is on our substance use programs. According to the Center for Disease Control and Prevention, otherwise known as CDC, in 2022, more than 109,000 Californians lost their lives due to overdose. Locally, that equates to the amount of people who can fit up to the local Sacramento Kings Arena, 6 times over. Overdose is the leading cause of death for non-elderly people in California. Let me say that again. Overdose is the leading cause of death for non-elderly people in California. And sadly, these numbers are only expected to increase. Let's talk a little bit about the challenge and how we got here. Historically, the federal and state government have responded to drug use with incarceration and extreme policing of Black communities. Under the banner of a war on drugs in the 80s and 90s, the federal government criminalized drug use and drug possession through a series of punitive laws. For over 50 years, we have all suffered the consequences of mass incarceration. People of color and those from low-income communities were disproportionately harmed. And people who use drugs have been deeply stigmatized and underserved through it all. However, we know that people who use drugs are deserving. They're not strangers, right? They are our neighbors, they're our family members, and our beloved friends. Fortunately, the good news is that the tide is turning. Community advocates, and you'll hear from 3 of them today, and families have led the way in showing the government that we can prioritize care over criminalization. At the Center of Sierra Health Foundation, we believe in centering the voices, humanity, and needs of people who use drugs in related policies. Our programs are aligned with this vision. So what is our approach? Throughout our decade of service, and yes, Sandy, we are so thrilled to be serving our 10 plus years of existence, the center have had the privilege of managing approximately $677 million in grants for the continuum of care around drug use. On behalf of the state of California and in deep partnership with the state, we manage programs that work to end opioid overdose death. Some of our partners focus on sharing useful and honest drug education with young people, and others are supporting wellness for people who use drugs. The center is focused on normalizing harm reduction approaches through public health and healthcare setting, including access to safer drug use tools and holistic, non-judgmental care, regardless of a person's drug use status. And we do this by partnering with community-based organizations that are disproportionately underserved and harmed. We truly believe that people who are closest to the harm are in the best position to determine what the solution is and be able to bring to it transformative, creative approaches to addressing the issue. And that is why we've been intentional in our practice, in the way that we work with partners, in supporting efforts to open many doors to care so that people can walk through the ones that best aligns with their vision that they have for themselves. If you or someone else in your family are using drugs and would like to make a different choice, there is help. I want to make sure that our community partners know that, and you don't have to go at this alone. So today, as Sandy said, you'll have an opportunity to hear from 3 of our many community partners who are doing incredible work in their local community, who are each responding to the community's needs in their respective ways. In Marie, in Braunz, and Arlene, you'll hear about their approach and how they're working deeply and unapologetically in BIPOC communities, and how they bring to it a culturally and linguistically appropriate lens to the work that they do. So with that, Sandy, I want to thank you, and I'll turn it over back to you.
Thank you. A couple of questions. You said that drug-related fatalities were the highest cause for non-elders. What is your cutoff, speaking as an older adult? How do you define older adults? And to what extent does this cause of death affect older adults?
That's a really good question, Sandy, and I know that I don't know if the government has a particular definition for that. I would encourage our community partners, Marie, Braunz, and uh, uh, our partners to respond to that in their respective remarks. We are, and I will come back to you with some feedback in terms of how we define older adults in our portfolio, but I don't have that response to you immediately.
That's fine. This is what this meeting in many ways is about: raising questions, opening up the subject, telling us that we don't what we don't know until we really begin to focus. You mentioned care over criminalization. Politically, and I'll say this as somebody who's been supported by foundations for many, many years, but substance abuse and recovery must not be one of the most popular topics or fields for philanthropy. So the center and Sierra Health have been really out in front on this topic and promoting care over criminalization. Can you speak a little about that? You are taking the lead in a way in an unpopular topic.
Thank you for that question, Sandy. In our focus really around care over criminalization has become really illuminating to us from our community partners who have for a number of years felt the burden of what it's been like to be the victims on this war on drugs. It's impacted them, their communities, impacted their family members. It has had generational implications. And so at the end of the day, for us, it's about reframing. It isn't about criminalization. We all make mistakes, but everyone deserves a second chance. And part of that is being able to offer opportunities to access care and services wherever it is appropriate and wherever it is accessible. And that is why, because of our own unapologetic focus on health equity and racial equity, why we come to this space. Care over criminalization, no judgment, no stigma, but the deep realization that every individual deserves the opportunity to help themselves, to be given a second chance, to be seen as a human person, to be able to be offered services in the most dignified way. So that is how we've come to this work. That is our approach. It's the approach that we bring to our substance use portfolio, is the approach that we bring to all of our work across the 50 programs in an initiative that we implement here at the center.
Thank you. Please stay on because we'll have a follow-up question and time for a follow-up statement. And thank you so much for leading off this briefing. So our next speaker is Marie Perez-Ruiz, who will discuss the work of the Central Valley Empowerment Alliance, which is based in Poplar in Tulare County, and how this organization is dealing with the impact of fentanyl and other addictive substances on particularly unincorporated areas of the Central Valley. Marie Perez-Ruiz, thank you so much for joining us today.
Thank you, Sandy and Cain, for the invitation and for creating a space for us to share, the lived experience of our rural communities. I would love to start with just showing this beautiful photo aerial photo captured by Adam Perez of Poplar. And this is just one of the many communities that we're working. It's a population about, the census indicates 3,200, but we know that it's over 5,000 people in living within 700 dwellings that are decaying. This is one of the, located in Poplar. This community is very rich in so many ways. The UFW farm worker movement began in this community. The fields that you see around are the ones that were negotiated by Dolores Huerta and Larry Ilion and Cesar Chavez in the 1965 grape strike boycott. And this is where the first agricultural labor contract was won. And currently Tulare County does not have a union contract. And the fight to empower our farm working communities in the 1965 led to a number of redlining policies that have impacted us today. The Tulare County Housing Element has indicated that Poplar is one of 13 out of the 15 communities in Tulare County that has no future. And because it's been defined by the housing element as a community with no future, that meant that there hasn't been any investment, any infrastructure in rural communities. In 13 out of the 15 rural communities in Poplar. And so, with the opportunity that we've been gifted by the center, we've been able to negate that narrative, and we continue to fight that narrative that communities like this don't have a future. The dwellings are decaying, there hasn't been housing developed in over 50 years. And you see 3 generations, of over 20 people living in small 2-bedroom dwellings. And this has been impactful in so many different levels as we address health access, and health equity in our communities. So I just wanted to start with this visual because this is one of the many rural communities that we're working. This particular community has 40% Filipino farm workers, new immigrants coming from the motherland, speaking Ilocano, and the other are about 50% Mexicano, Spanish speaking, and then we do have Yemeni because our Najib Taifala, the martyr that was killed in 1972, he was organizing the fields around that you see here. So there is so rich in history, yet it has been neglected and there hasn't been any infrastructure. It doesn't have a park. It doesn't have a clinic. There's no fire, no first aid responders or any. All of those systems were closed once, the 1965 grape strike. The first labor contract was signed in the 70s, and as a result, communities like this were punished for that. And so, if we can go to the next page, slides. We serve 5 different counties, Madera, Tulare, Kern, Fresno, and Kings. And our focus is primarily on incorporating farm working communities. Just because we have found that, in our rural communities, there seems to be so many different, this is where the most vulnerable of our community members are at. This is where in Madera, we have a high concentration of indigenous from Mexico farm working community. In Tulare, we have our Filipino and Mexicano farm workers and Hmong. In Kern County, we see our indigenous and immigrant Mexicano farm workers, and so forth. We see that quite a bit, but yet we noticed, that there hasn't been an effort to really go to the rural communities because quite often, some of our big organizations tend to go where there's a higher population. It makes sense for many of them. You go in, you get the most people and so forth, but we are different. We are intentional of going to the most rural, unincorporated, where you see 300 homes, 100 people, 5,000, whatever it is. So we actually kicked off a campaign, our rural health equity campaign, led by our youth. And we actually have gone to Tonyville that experienced the floods. I don't know if you saw it in the videos. It was in the media. And this is an incident where the floods happened. Our rural community was flooded. Yet, we have the FEMA and bring the Homeland Security and table together. And so our community did not show up because of the fear, and so forth. Can we go to the next slide? Thank you. This is, our youth, this is some of our youth captured in one of our enrichment programs, activities that we did. We brought them to the Oakland Zoo. And then we decided to make it, swim by. They wanted to walk that Golden Gate. This is the first time for most of them that have ever been anywhere near the Bay Area or seen the Golden Gate or seen the ocean. There's nothing much is expected of them. Only 3% of them are expected to pursue a higher education. It does not mean graduating. It just means, they attend, and many, there's very, very little data, but all of them are receiving the free lunches. You see a diversity of here. We have indigenous, we have, Filipino and Mexicano. And that is what we're trying to aim to do, is to build a beloved community. I see promise. When others said there's no future, I see a beautiful promise of what it is possible. And our goal is, our values are aligned with unconditional love. We're not afraid to say that, unconditional love. And our organizing is an expression of radical love, which means there's no judgment. And we meet people where they're at. We meet them where they're at.
Marie, could I interrupt you just for a minute?
Yes,
Because
of course.
time constraints. Tell us how this population that is obviously very underserved, how are they experiencing the substance addiction, the fentanyl, the pervasive use of fentanyl? How worried are you, and to what extent is this a priority in your work?
We thank you for that question. So this is a serious and a very dire problem for us. Our rural communities are the target for the cartels, is where a lot of the drugs are passed. And we have created spaces where some of the youth, some of their parents are the users, and some of them are the folks who actually are selling or are on the Black, economy, underground economy, so we try to create a spaces for the youth to come together, and we have conversations with their parents. This is Lupus Promise Center. It's literally a garage that we converted into a center where we have 65 youth come and gather in a week, but the goal is to bring community together and create safe spaces. And we have those very candid conversations. We have conversations with the parents, and actually our parents sign an agreement, a covenant, that our space is gang-free, is drug-free. And we work with our adult parents, looking at, trauma-informed, principles, and we work with them and trying to address and doing harm reduction with them, and so we do a lot of circle together. We do a lot of one-on-one. We go to their homes, but also too, their youth have been instrumental in this process as well. When we first opened the doors, many of our parents didn't want to bring their youth because, of this, because we've been very clear that we are gang-free and drug-free, but we're able to address that, and how we can remove ourselves from that, how can we, and we able to refer to outpatients as well, our parents. But when they see their youth and when they see the possibility and how their youth are coming together, we've seen how our community is changing, and how they see their role in the community. They're coming in to volunteer. It doesn't matter. It doesn't matter if one is the supplier and one is the user. Our goal is to address it, and not to ignore it.
You mentioned that you're developing with the youth a park, which is in a region that has no parks. It's park poor. And could you just say a little about the naming of the park?
So Poplar has no park, and we were able to, with our youth advocated to the district, and they agreed. And together we raised $1.4 million. And in this coming month, in February, there's going to be the groundbreaking of a community park. And our youth advocated that it be named Najib Daifala Unity Park, named after the Yemeni farm worker who was killed in 1972 while organizing the fields around Poplar. He was a young person of 22 years old. He's someone that they identify with, and that they felt that he needed to be recognized, that his role in the history and the movement, his role in how he shaped the story of Poplar needs to be recognized. So this is, we have taken our youth have been involved in advocating for their community. They've gone to Sacramento. They spoke with Councilwoman Barbara Lee to talk about housing, our unhoused, looking at, how to, there's been displacement of our farm working community. So they went to advocate for their families.
So in just because we've run out of time,
Yes.
but this is such a powerful window into an area of the Central Valley that has largely been invisible for many of us as reporters. One last question, and the photographs are wonderful. We're going to send them as part of our collateral. One last question. Is there a problem with crime in these unincorporated communities that your approach, which is really engaging particularly young people to bring the whole community together around the possibilities, things like a beautiful park. Are you worried at all about crime linked to the underground economy of the cartels?
There is, and because there has been, first aid responders take 40 minutes, 30 minutes to show up. So quite often, they're not there when community needs them for health or emergencies. So there's this level of, there's no trust within community and law enforcement. So quite often there is a high level of crime, but community is not, it's not speaking out about it. What we have been doing as an organization, as a programming, is that we have been working with the youth, with beautifying our community, with showing them, engaging, our folks that are engaged in those things, and just discouraging them from that. Our facilities, the work that we work has never been vandalized. And there seems to be a high level of respect to what we're doing, but we wanted to transcend into the bigger community. And our hope is that as we move forward, that we will be able to create this level of trust and, and bring the systems so that we are able to, but we believe that the park is going to be key on that. It's going to instill pride. We're bringing Carlos Perez David, a muralist, to come in and draft a beautiful mural that is going to be 50 feet long, that will be capturing this story.
I have to cut you off, but there are questions for you in the chat. Would you, while you listen to our other speakers, also just respond on the chat in case we don't have time to get back to you in person? But this has been a tremendous window into Tulare County and the other surrounding counties where farm workers live in very isolated regions that are underserved, and there is a real problem with substance abuse. One of the questions, Marie, is whether there is any data on how frequent or how high the level of drug use is, and perhaps you could respond to that on the chat.
Okay.
Thank you so much. And our next speaker is Arlene Brown, founder of Crossroads Recovery Center, which is based in Bishop in Inyo County. And she will discuss the harm reduction programs that this center is pioneering to serve Native Americans and other residents of Inyo and Mono counties. Welcome, Arlene.
Thank you, Sandy. Manahu Inani Arlene Brown. My name is Arlene. I'm an enrolled member of the Bishop Paiute tribe here in where I live and work on the live on the reservation. I'm humbled to be here and honored to be in this space with everyone and to give some insight into it, the crisis here and everywhere actually for Native Americans. As you guys may or may not know, Native Americans have some of the highest fatal overdose rates, not just in California, but nationwide. And so it's a very, huge issue. We are the original people of the war on drugs, right? We were the first victims of that actual war on drugs. And so that has been something that has been with us ever since, colonization started way back when, right? And so one of the things, that we really specialize in is decolonizing services because there are services that were never built for us in the first place,
Now,
right?
say that again, Arlene. Decolonizing services, and what is meant by that. Many of us are not English speakers primarily, so it would be very helpful to have you define that term.
So we have services that have been built for us by service providers in that colonization process. And so decolonizing it means that we make it our own. And so that we take down everything and dismantle it. And so we make it our own. We want to make everything indigenous, right? And to make sense for our own culture. So that's what I mean by decolonizing services.
Great. Please don't let me interrupt you. You're on a roll. Go.
So like I was saying, being the very first victims of this war on drugs, we're able to fight back in a way, with the center's help in some of the grant funding that we've been able to receive to do amazing programs like naloxone saturation but we just do it in our own way. So we have opioid overdose reversal kits, and we have them completely indigenized, all the way from like prayer tags on the bags, culture kits that we're able to give to people. We know that first responders are people who are using drugs. And so one of our programs that we've created is the wellness journey, because we also know that isolation and stigmatizing and further pushing out people doesn't work, right? We know the punitive piece doesn't work. And so we want to make sure that we are engaging and working closely with people who are using drugs. We also operate one of the first certified syringe exchange programs in California that has been culturally specific.
Just say it again, because you're speaking a little fast for our interpreters. Say that journey again.
It's the wellness journey, and it's an indigenous-based model of care that I created to engage and work actively with our Native population who are using drugs. And so it engages them weekly with case management services. It has them, we do a program, and it's based on contingency management. But see, we made contingency management our own because we decolonized it, right? And so we have it in a medicine wheel. And so participants, they just make their own goals, and they could be health related. They could revolve around, their physical health, getting tested for HCV or HIV, whatever goals that they have. Spiritually, mentally, physically, and emotionally, because one of the things, like with the Western model of care, is just treating one symptom or one piece or one part of a person. And we know as Native people, you treat the whole person. You treat the individual, the family, and the community, right? And we've never needed anyone to tell us what our healing ceremonies or practices are, which is why substance use services like traditional ones weren't designed or created for us, because our healing doesn't take place within those four walls of what like people will say our healing should look like, right? And so we just take ownership of that process. And so the healing journey could actually get people right from using substances to rehab if they want to go to rehab. But the engagement piece is huge because the other part is the connection with culture. We have language cards that are done in our Numu language. We give out traditional medicines. And so we found a way to try to keep people inside of our sacred circle. And so we talk and speak, in a lot of cultural terms. So it's important to us to keep our loved ones who are out there using drugs and alcohol, to keep them within our circle, because we don't want to further isolate, shame them, and punish them for substance use issues, right? We already know that doesn't work. And so the wellness journey helps us do that. It gives us a way to protect our culture. It helps us reduce the overdose in our community. I know we've had over 80 people's lives saved. And then we share our healing with others, right? So our programs are never just for natives, even though they're indigenous, and they have that whole framework. One of our core values as Native people is our generosity. And so we share in that healing with others. And so everyone is welcome in that space.
Could I ask you quickly to tell us, Inyo County has 5 reservations, and some 17% of the population, you told us, is Native American, predominantly living on these reservations. Is there a stigma in tribal communities about people who do use drugs? And is one of the ways you're combating this to show the embrace of the Native community values and rituals that are not closed off, that indeed they are part of the healing journey?
Right. So we've done a lot to destigmatize services. And early in this session, there was a question that you had, Sandy, about our elders, or elders in general. And one of the things that we've done is for naloxone, just for example, I think there was a lot of misinformation and misunderstanding about what Narcan is for, right? And people talk about it's just for people who use drugs, it's just for that. But the way that we have framed it, because the way that it really is that it's for everyone in our community, whether you use drugs or not. It's for our elders who get prescription medication, who forget that they took their medication. It's for children in the home because someone didn't lock up their medication. It's for people who do use drugs. And so naloxone is just one way that we've really destigmatized it and helped our community understand the importance of having it. And so we give it out a lot, right? We have a lot of saturation here with naloxone, and that's just one example of that.
One last question before we move to our third speaker on the panel. To what extent are non-Native people really impacted by and affected by this very deep cultural community embrace approach? Even though it's Native American, how would I be able to feel welcome in it were I to come to you for substance abuse problems?
Right, about 50% of the people we help are non-Native.
Wow.
Mm-hmm.
Thank you. That is a terrific point, not the point I want to close on, but the point I want to hit pause and go to our last speaker. And then we will circle back with some additional questions. Thank you so much, Arlene Brown.
Thank you, Sandy.
Our third speaker of these 3 very important nonprofit organizations really on the front line of fighting substance abuse and trying to reverse the rise in fatalities is Braunz Courtney, who is the executive director of the HIV Education Prevention Project of Alameda County. And welcome, Braunz. I believe your headquarters is actually in Oakland.
Yes, thank you so much. It's a pleasure to be here. Hello to everybody who's participating in this. We like to call ourselves HEPPAC because the name HIV Education and Prevention Project of Alameda County is long. So if you hear us refer to us, it is HEPPAC. We have a program that's supported by Sierra Health Foundation that I created called East Bay MAT Expansion. And so this is EBME. You know, in public health, we talk in a lot of acronyms so we can cut to the chase. And part of EBME's main goal is to get out of silos and create equitable access for medication assistance treatment, which we call MAT, another acronym. So HEPPAC has been in harm reduction for 30 years and is an internationally known, nationally recognized, and locally respected Black-owned and Black-led harm reduction agency in the Bay Area. As you stated, our brick and mortar, the building that we are so fortunate to own, is in Central East Oakland, and we serve a lot of places within Oakland from west to east, but we also serve our neighboring county, Contra Costa, and the neighboring county to Contra Costa, which is Solano. So HEPPAC's approach is on a regional basis, which is what we are working towards in the East Bay MAT expansion, getting people out of their silos. Our goal of EBME is to just that, getting all the providers that are offering MAT in the different ways that they offer it, and we get together and we talk about best practices. We talk about equitable access. And to start with MAT, we start with the conversation around harm reduction and recovery. Recovery from an older perspective, a lot of folks think means sobriety. So our goal is to talk with people openly in an ambivalent way around their relationship with their drug use. Not everybody who is in recovery is going to get to sobriety. Our goal is to meet each individual where they are at geographically, as well as within their addiction, about where their goals are and where they're trying to get to. What are the great things about their drug of choice that they decide to use? And what are the things that they want to change that are unhealthy? Because some people will never get to a point of sobriety. But if they're doing something to administer their drug of choice in a healthier way, that is their recovery goal. Harm reduction, as we talk about it, is a spectrum. So we've got people in their chaotic stage of use who everything and anything that they're doing is about administering that drug, right? Their lifestyle. Then we have other folks who are on the other opposite spectrum, which has decided maybe abstinence is the best way for them to work on their use and work on their relationship with their drug. And we meet people in between all of that. Our goal and how we do this is by hiring people with lived and living experience to be substance use navigators. So this is what we kind of have as a norm for us. We take people who have either been in substance use recovery, currently in substance use recovery, active users, right, who are interested in working with their peers around accessing MAT in a different form. It's not always in a clinical setting. So HEPPAC hires substance use navigators who may have been people and participants of our syringe service programs in non-clinical settings in these areas you see in my avatar backdrop, where we're out in the community in what we like to call the trenches in areas where there's not a lot of services. We have to think about access in the way as some people think when we go to a doctor such as Kaiser, that that's our only access to medical. When we look at access as universal, when you come to a place like HEPPAC who does non-clinical settings, integrated services, where we have a doctor, syringe access, substance use navigators, hygiene kits, coffee, snacks, you know, things of that sort, that people are actually accessing medical. We traditionally don't go to the Kaisers and the medical homes to get food and safer drug using supplies and have an open dialogue around the ambivalence of their drug use. Because most of the time, when folks have been in their experience, it's been very punitive to talk about their drug use. And they're just referred to stop using drugs. When they can have open dialogue around how is your drug use doing? What are you doing within your drug use to stay safe, to prevent from opioid overdose, to prevent from abscesses, to prevent from death, right? How do we not only survive while we're still in this war on drugs, but how are we thriving? Substance use doesn't live in a bubble. And because we have integrated services, we're always addressing the term that everyone is using, and you'll hear it a lot, social determinants of health. We know that when a person is wanting to access substance use treatment, that they are also dealing with other things that keep them healthy, like housing, food security, hygiene equity, right? Social interaction, getting people out of their isolation. And so having an integrated service model helps with that. We like to call it a one-stop shop. You can come to a brick and mortar where HEPAC substance use navigators may be, who are the same sons, and that will use the term substance use navigator is a son, where the same sons were the individuals who were also in the street setting. So we want to combine clinical and non-clinical settings as this merged public health model so that it kind of flows all together. If you decide you want to go into a clinical setting, hey, you have HEPAC staff who are there. If you decide that going into a larger facility that may have traumatized you in some way, you can access medical and other services in a street setting, a non-clinical setting. We like to just say that we offer basic needs. As we have seen, a lot of people who come and want to talk openly about their drug use are not necessarily ready in that moment to access substance use navigation or get into medication assistance treatment. They just want to get basic need resources. They want to have open dialogue about what's messed up in their life, what is some crisis interventions, what are some other services that are going to benefit them. Some of the other services that HEPAC offers are overdose prevention, education, and naloxone distribution. That's a long name, so we call it OPEND, right? That's an acronym for our overdose prevention program, where we identify people who may be at risk for opioid overdose, we train them, we get Narcan and naloxone in their hands and in their communities, and we make sure that we check back in with them on how is that going? How is it to even carry Narcan? If you don't have Narcan on you and you're witnessing an overdose, it's not going to help you. So identifying what is the barrier around just even having Narcan on you? Oh, it's I have a lot of stuff. Well, let's create something. Let's create backpacks for you to carry not only your personal items, but Narcan. Let's create keychains so you can have. And then a lot of times people just like having those novelty things. You can put your condoms in there. You can put your drugs if you're still using drugs. You can also put your Narcan in these kits and have open dialogue with staff around how you're at risk for overdose, what you're doing to prevent from overdose. We also have our SSP, which is Syringe Service Program, which is what you see here. And you can get syringes, safer drug using kits, as well as see a doctor and get free acupuncture and herbs.
Okay, you have a very important question from one of our reporters in the chat, which is how can an individual who is addicted to drugs also know what their best course of recovery is? And that's from Kenneth Miller.
Good question, Kenneth. It's about asking the question and us seeing what is the goal of that individual. We deal with people, like we said, in their chaotic stage of use. Some people may say, oh, this person is, and they use the term strung out, or this person doesn't care about themselves, or this person is just like wilding out. But if somebody, even in their chaotic stage of use, decides to show up to a syringe service program, that actually means they're taking care of themselves. They might not want to talk about recovery. They may just need a snack and be in a setting where they can have open dialogue around where they're at in that moment. And their goal may be just to, I need access to sterile drug using equipment. And maybe later, months, weeks, they're ready to talk about drug treatment and what that looks like for them.
Thank you. I have to cut you off at this point in such a fascinating presentation. One final question before we go around to each of our speakers. How would you measure the impact of substance abuse in the communities you work with? And to what extent is it age defined? Is it racially defined? Is it income defined?
We know that the impact that is disproportionately impact is Black and African Americans. And this goes across the board for a lot of other issues, other health related issues, but actually within overdose. And most socially, economically impacted is Black African American folks in Oakland and in Contra Costa County. We see this through our quantitative as well as our qualitative data. And the impact of programs that do integrated services and harm reduction programs is to keep people healthier, alive, and able to thrive. We see people that have reversed overdose, which means these are people who are now walking and living because of services like what all of our panelists are offering, right? As well as, what HEPAC offers. These are people who are still alive to this day because they have access open program, syringe service program, drop-in center, our Black Drug Users Health Hub programs.
Right. Thank you so much for an excellent presentation, Braunz. I'm going to go now to a question which I'd like each of our speakers, starting with Kaying, to address. Marie Perez-Ruiz used the term communities without futures. I would say many of us write off people with substance abuse, especially those who are unhoused, often living on the street, even if they are housed, but somehow as if they've already gone over the cliff. And this leads to impatience and why are we having to spend so much money on a hopeless cause? The three of you and Kaying's Center are evidence to the contrary. You are seeing real progress based on an embrace of people by people whom they feel are their community. I would love to ask each of you, including Kaying, to kind of take a step back and very quickly, each of you has a minute. What is it these approaches have in common that makes this such a transformative and hopeful approach to substance abuse? And it may be too much to say, but you are all evidence that the communities you work with of substance abusers and often their best friends, their family, their relatives, do have a future. What is the common element that combines these three approaches? Kaying, you're first.
Thank you, Sandy. That is a wonderful question, and I'm not sure if I'll do justice to a response in 1 minute. But I will say at the heart of this is this deep belief, and we've heard this from all three of our community partners. It's a deep belief in community, in a community that has experienced deep and historical traumas, whether it's racism or the whole host of issues that Braunz mentioned. For us at the Central Sierra Health Foundation, we bring a social determinants of health lens to our work. It's in these communities, particularly communities that experience deep environmental injustice, communities who are having challenge experiencing or accessing education, communities who are experiencing deep homeless situation. But we truly believe that at the heart of this is the ability to give community the tools to be able to believe that they do have a future, that their community is deserving of a future, that there is hope, that in the fact that they've survived, right, the war on drugs, they have survived any hardship that has been thrown at them. There's this deep appreciation of resilience. And that is what this is all about. It's about leaning into individuals' deep sense of resilience and hope by being able to offer them services everywhere, whether it's in community or in language that they can understand from providers who look like them, being able to make sure that a newborn has the same opportunity as someone who has lived and worked in the communities for many, many years. That's what it's all about.
Okay, thank you so much. Marie Perez-Ruiz.
Thank you for the question. It's powerful. You know, it's seeing their humanity, and holding hope when perhaps they don't have it for themselves. It's being able to see the beauty within and their promise, and creating spaces for them to realize that promise. For us, you know, it's the unconditional love, you know, as well as, you know, the sense of together building a beloved community. That because regardless of where we come, we want something better for our young, for our children, for the future. You know, so there's a commonality of it that transcends, you know, the different demographics, you know, that we work with. You know.
Right. Thank you. Arlene Brown,
Um,
you've
for-
heard from our other speakers, and you have been a speaker, and I guess this idea, what is it you share in common and you hear other people echoing, even if it's using different terms?
it's human connection, and then also common sense. Taking away all the barriers to care. You know, that's something that's super essential, and letting people know that they're not defined by their substance use by any means, and that they are heard, seen, loved, and cared about, and that they are really worthy of all the good things in life and deserving of all of it. And so I think it's increasing self-esteem, empowering them, and just letting them know that you are just not another statistic, not another number or any of that, and that they're just, you know, loved, supported, and heard, and that their immediate needs will be addressed because people care about them. And I think that's the hugest part of all of this work. And I know it is, because the people tell us, you know, we've never felt loved or cared about, because they're always on the other end of feeling like they're tossed away, worthless, not worthy of even getting sober if that's what they want, because they've heard it so many times and they've internalized a lot of the stigma. And so for us, it's, you know, and it's how in with everyone else, it's breaking those chains of that and letting them know that they are very worthy and very loved. And you know, it's some of the most amazing work ever. And working in the syringe program, like the people who are actively using, you know, they're my favorite bunch of people. You know, they're just grateful, humble, and dependable. I also, you know, worked in an MAT clinic, and we do a lot of MAT work too, and doing it, you know, like an indigenous model of framework for medication for opioid use disorder. And you know, our syringe exchange program, like they're just they're always all about it. So I'm honored to work with them. So
thank you. And lastly, Braunz, you said an amazing thing when we first talked, which is that in a way you don't believe in the idea of health homes. You believe in creating homes wherever people are in need. Could you also just bring your perspective to the common threads we've heard today?
Thank you so much. Yes, equitable access and normalizing all of our homegrown interventions, that participants who access the service have had input on how they want to access it, right? This is the normal standard in public health, not the people at the top, administrators and government, saying, oh, this is how your community should be doing it. But no, hearing from our community on what do you need? What is going to make you want to come to this place and be healthier in whatever state of your substance is? We're not here to tell you what to do. We are literally navigators. We're like Siri on your phone. I want to get to this, and we're the ones who tell you how to get there. We'll tell you the detour. There's going to be a barrier here. Let's talk about strengths-based approach. You've lived this long, and you're an expert in your own life. Let's talk about when HEPAC's not here and when these other agencies are not here, how are you going to manage this barrier and get to your end result? The old saying goes, you give a man a fish, you feed him for a day. You teach him how to fish, you feed him for a lifetime. And that's what we want to do. We want to teach people how to fish So then when we're not here, they know how to access these resources. They can be a part of the integration of this in their own communities, and people are out here doing the work. Like I said, we hire participants who are now leading their peers in getting access to MAT and becoming the new leaders in public health.
Thank you. The three of you have given us a deep appreciation for the work of the center at the Sierra Health Foundation, because each of you have told us that without that support, it would be very difficult for you, very grassroots, very isolated often from the larger nonprofit and public health agencies. The center has recognized the value of this work and is supporting it. So for that, our final note is congratulations, happy birthday, and may the work of the center continue. Thank you so much for your presentations today. Our conference is now closed.